All the research I have done, and I've done quite a bit of research, very clearly shows that the immune system is critical to overall health. And the immune system is dictated by the garden of bacteria in the gut. We have 38 trillion microbes in our body. The majority are in the gut. And we only have 30 trillion human cells. We're more bugs than human. And these bacteria do wonderful things for our body. And when they're in a state of balance, and there are thousands of species, when they're in a state of balance, they allow and communicate with the immune system to function properly. They talk to the immune system. There are so many bacterial cells and only 100,000 or so immune cells. So they communicate and let the immune system know where the body is being invaded in any and every mucosal tissue of the body. It talks to the immune system that's lining the gut. 70 to 80% of our immune system is in the gut. And then it goes to work. Now, when the bacteria are not in a state of balance, something happens and pathogenic bacteria overgrow because of a poor diet. Maybe over-exercise and oxidative stress, maybe under-exercise, maybe emotional stress, maybe dirty electromagnetic fields that you and I are talking through right now, maybe poor sleep habits. There's so many factors that can disturb the healthy gut microbiome. But if that gets disturbed, it affects the immune system. It causes holes to form in the epithelial barrier of the gut, and junk that normally would stay in the gut and eventually get excreted through the rectum get leaked into the blood system. When that happens, everything goes haywire. It's called metabolic endotoxemia. It's infection and inflammation in the blood system. Sometimes it's slight, sometimes it's severe, but it can go into every organ system in the body, including the mouth. And it changes the ability of the immune system to function, and it changes the complexity of bacteria in the mouth. So we have possibly 700 species of bacteria in the mouth. Everybody has maybe 200 or 300 of their own bacteria. Everybody's bacteria is very unique, that the composition is unique. When the change occurs, when the immune system is compromised and different pathogenic bacteria overgrow because of a weak immune system, bad foods feed these pathogenic bacteria, and all hell breaks loose in the mouth. And then it can spread through the rest of the body. But here's one very critical element. The tooth is the only structure in the body where a hard structure penetrates the epithelial tissue and embeds itself in sterile bone. Think about it. It's a sliding board. If you have bacteria around it, it can slide from the tooth into the sterile bone and create necrosis in the bone. You'll lose your jaw. You'll die. So the body has created many methods to protect it. Under the gum, there are all kinds of immune system cells to wreak havoc with pathogenic bacteria that want to enter the area. But there is a first line of defense, which is a natural biofilm that surrounds this crevice where the tooth pierces the gum and embeds itself in the bone. And it's called dental plaque. Dental plaque is healthy. You don't want to remove it. Dental plaque has three main functions. It's made up of 200 or 300 species of microbes. They produce hydrogen peroxide. That peroxide literally kills other potential pathogenic bacteria living in the mouth and the saliva that want to get into this crevice between the tooth and the gum. It literally kills them. It also has chemical buffers that protect the acid from going below a pH of 5.5. So it protects the root from tooth decay. And it also is the gatekeeper, allowing minerals from the saliva that pours out in the mouth 24 hours a day, 7 days a week. It allows these minerals to penetrate its surface and get into the root to remineralize the root surface of the tooth to keep it strong. So this is a protective barrier. So what do dentists want to do? They want to not only clean it off, which is not a big deal, because the pellicle, which is the first layer of the plaque forms every 12 hours. But they don't just clean it off. They prescribe antimicrobial toothpastes. They prescribe antimicrobial mouthwashes. They prescribe chemicals like xylitol that prevent the pellicle from forming. They want to remove all of this dental plaque. They tell children to use these disclosing tablets that dye the dental plaque red, and they're told to scrub it until all the red goes away. In other words, scrub that harmful dental plaque away. Well, the harmful dental plaque isn't harmful unless it gets overly infected with pathogenic bacteria, and that's a different story, and we can talk about that. But if you have a healthy gut and you have a healthy diet, that dental plaque is healthy, and it serves a very important biological function.